Hi, my name's Lynn, and I want to introduce you to a consultation support tool that we developed in the cancer department of a large teaching hospital in the East Midlands. This was part of a research project supported by the University of Leicester. A group of patients who were diagnosed with cancer and some carers were very much involved in this research project from the start and helped with the final design of the consultation support tool. If you'd like to know more about that study, then please look at the publications page on the website and go to the article in the British Journal of Cancer called Improving Consultations in Oncology, and the link will take you to that paper. In summary, though, we wanted to develop a tool which could be used jointly between patients diagnosed with cancer and their doctors or senior nurses to improve communication and the sharing of information in the consultation, and to create a positive consultation experience for all involved. As a team of clinicians working in cancer services and academics, we recognised that there was a need for such a tool to be developed. At the start of the study, we had absolutely no idea what the tool would look like or what information it would contain. The final product would be determined by what patients and doctors told us about their consultation experiences with each other and what we learned from the audio recordings of these consultations. We found that despite advances in the way that doctors are taught communication skills, some were often uncertain or hesitant about what information they could share with the patients about their cancer diagnosis and possible prognosis. And prognosis is a doctor's opinion of the likely or expected progression of a disease or a patient's chances of getting better. This is often a difficult conversation to have with patients and can often be the elephant in the room because nobody really wants to talk about it. Some uncertainty also came from the fact that they didn't always know what information their colleagues in other departments might have told patients before they saw them, and they couldn't always tell how much information a patient wanted to know. This is not a new finding and is a challenge mentioned in a number of medical journals. We also found that patients needed to be better informed about what happens in consultations and how the conversations may unfold. They often didn't know what to expect. They also needed to be better informed about how they might want to prepare for a consultation. And by this we mean think about what level of involvement they might want to have, what they specifically wanted to know, or whether or not they wanted detailed information, and how involved they might want to be when making decisions about their care and treatment plan. When we designed the tool, we ran some focus groups with patients and doctors to explore what they thought about the tool, and their views were really very positive. And a number of patients told us that they wish they'd had such a tool when they were first diagnosed with cancer. The tool's in 3 parts. There's a booklet called Your Consultation, which is designed for patients and their families to read. The information in the booklet is taken from what patients told us they wish they'd have known about when they were first diagnosed. There are then 2 leaflets. There's a first consultation leaflet, which we anticipate patients using when they first meet with their oncologist. And then there's a follow-up consultation leaflet to be used when patients feel the need to use it. And the idea behind these forms are to help patients think about and write down what they already know, what they want to know, and how involved they might want to be in terms of making decisions about their care and treatment, and share that information with the doctor so the doctor knows where the patient's coming from and addresses some of that concern that doctors have raised with us. The third part of the tool is a booklet called A Doctor's Guide, which is being produced to remind doctors of the basics of communication, again based on the findings of that original study. We've created 2 short videos to tell patients and doctors how we think or anticipate that they might want to use the tool in practice, based on some small pilot work that we've done using the tool in the oncology department. So before we can go out there really and start using the tool routinely in clinical practice, we want to design and carry out a much larger research project using the tool. But before we can do that, we want to invite patients, again diagnosed with cancer, and their doctors or senior nurses to use the consultation tool with each other. And we want to know if using the consultation tool has been useful, whether we've missed anything in it, or if it's easily accessible online. We've included a short questionnaire which we hope you would complete to help us develop this work further. And if you'd be interested in chatting to us, then we'd really like to speak to you, because we want to know more about your experience of using it and accessing it. If you're willing to talk to one of the team, then please indicate this on the questionnaire or use the contact page on the website to get in touch with us if that's easier. Any chat, we hope, would be kept brief and to a minimum. We don't want to take up too much of your time, but we'd be interested to talk to both clinicians and patients. And we can conduct a short discussion over the phone, via email, or on Skype, for example. So thank you very much for taking the time to watch this video. Get out there and start using the tool. And we really look forward to hearing from you and learning about your experiences. And if you have any other questions that aren't addressed in any of the short video clips that we share with you, then please don't hesitate to contact us for more information. Thank you.